Good afternoon. It's a very great pleasure that I introduce Professor Bart Renel from the Catholic University in Leuven in Belgium. Professor Purnell is a long-standing uh, expert in cryptography around the world. He's known everywhere in the world for his contributions. As a scientist, in the realm of hash functions, symmetric crypto, but also more recently in as his role in uh, talking in favor of cryptographic research around the world in the European Parliament, everywhere. He has visited many communities of cryptographies around the world, so a lot of people know him. Has visited Brazil, I think, at least 3 times before this, I guess. Mark, then they can confirm that later. And so he's known here too. We're very fond of his presence whenever we can talk to him and ask for advice. That has a lot of experience in all sorts of issues in cryptography. Has won many awards in cryptography and other mainly in cryptography and mathematics. So it's a very I mean, you can read a lot about Bartranel in the internet. So it's I just want to sum up and say welcome, Bart, and thank you very much. He's going to speak to us today about fighting a pandemic while protecting privacy. That's his experience with the software for fighting the COVID pandemic, but also dealing with privacy issues where cryptography was important, where it could help or where it could not help. Thank you very much, Bart. Welcome.
Thank you, Ricardo. And I think this was supposed to be my 7th or 8th trip to Brazil. I lost the count, and I really wish I was there. So this is working, yes, because of course here in Europe we have fall already, and outside it's 12 degrees and gloomy and rainy. So I wish I was in sunny Brazil, and I hope for better times. So it's a great honor and pleasure to meet with you, if only from a distance, because I always enjoy coming to Brazil. I like the hospitality and the friendliness of the people, and of course I also like nature there and all the great food, and I miss it, and I hope that soon the pandemic will be over and I can come and visit again. So today I wanted to talk about my efforts, and also of course with many other colleagues, on privacy-friendly contact tracing and presence tracing. I played only a very small role in this, but I made a small contribution, but also in Belgium, actually, I was the main architect of our contact tracing app. And so more or less in the past 1.5 years, I've transformed from a research professor doing research to actually an IT manager managing an IT system and dealing with legal aspects, with PR aspects, media aspects, also with incidents. So it was a very useful experience, although I hope, in fact, that I can go back to my normal life very soon. And things are, luckily, I see a pandemic that's quieting down, especially in the north of the country where I live. The vaccination rate is very high. It's about 80% or higher. And so we hope that things will get better. But so I'll try to explain what we did and also go some lessons learned. So I first speak about proximity tracing, the evaluation, and then I also say a few things on presence detection. In presence detection, the cryptography used is more sophisticated, but in fact, there was much less deployment of these systems. So I guess at this stage in the pandemic, I don't have to explain to you anymore what contact tracing is. In particular for COVID-19, there is this problem that you can be infectious without having symptoms. So if you just isolate people with symptoms, in fact, you could always be too late, because before you actually discover the symptoms, people have been infectious for several days and have infected others. So the strategy which you have to use is test, isolate, quarantine, which means, of course, you have to find the cases. Those you actually identify have to isolate. But then you also have to find out their contacts in the days before they were tested positive and before they had symptoms. and try to identify those people and also tell them to quarantine, to also stay away from others. That's seen as a core strategy to actually control the pandemic. And of course, it's a balance between shutting down everything, of course, and you have no contacts either, but then society stops, and having an effective strategy for contact tracing. And this is what many countries have tried. I know in Asia, some countries tried for the zero strategy, but most countries tried for a containment strategy based on testing and tracing, isolation and quarantine. So of course, you can only do this strategy if you have enough testing capacity available. If you don't test, you can identify enough positive cases. And the earlier you find them, the faster you can respond. You have to have sufficient capacity to respond to the cases and to take action. And of course, society has to support this. If society is against you and people don't want to contribute to the system, when they don't tell people when they have symptoms, they don't tell you when they have symptoms, or they don't give you information, well, it's actually an uphill battle. So you have to have also support from the highest political level and in society. So in the last big pandemic we had this 100 years ago, Spanish flu, we only had manual contact tracing, where people at the time went door to door. Today you will call people and you try to find out about the contacts of the last few days. This is slow and expensive. In Belgium, we did quite some studies to speed this up. In the beginning, it took about 4 to 5 days to reach all the contacts of somebody. With a lot of effort and IT developments, it was reduced to 1 or 2 days. But it's still quite slow. It means that more or less if you test positive on a Monday, that your contacts in the best case will be warned somewhere in Tuesday afternoon or Wednesday morning. So you've been walking around for 1 more day or 2 more days infecting other people. Of course, you may not always remember who you saw. And of course, if you have a lockdown situation where you can only see your family, that doesn't matter. But as soon as things relax a bit and bars are open, you can sit on a terrace, you can go to the office, you can use the bus or the train, then of course, you can't first memorize all your contacts, and the people on public transport, for example, you would not be able to know who it is, so you can't indicate this. So technology experts at the beginning of the pandemic were very optimistic, and they said, let's actually use technology, let's use an app to actually detect who was close to you in the past days. And many architectures have been proposed. Many app developers claimed they had the solution. What we thought we should do, this is a consortium of about 30 researchers led by one of my old students, Camila Troncoso of EPFL. We thought we should do this in a privacy-friendly way, and I'll come back to why we found this so important. So in principle, this can be faster. Most people, 80-90% has a smartphone, at least this is what I know for European numbers, and this actually will help. It can also be more accurate if at least technology works properly. It also works with strangers. So of course, the idea is not to just do the app only. You still also keep manual contact tracing and have the two things complementary. I think it was clear from the beginning that with the app only it would not work, if only because quite some people don't have a contact tracing app. And of course, those you would actually miss in this case. But so the key word is, can we do it with privacy by design? And if you look at what happened, so of course, the pandemic was first visible in Asia, in Korea and China, hundreds of apps popped up, and very many of those were highly privacy invasive. Now, it turns out that also in those countries, privacy may have a different meaning. And in fact, there is a different balance between social good and individual good, like privacy. So as an example, a quite extreme example, in South Korea, there was an app that would publish in an anonymous way the trajectory of infected people. So you could see that at 9 o'clock, they went on the street. I guess they left their home. They went to a coffee bar. They went to drop their kids off to school. Then they went to the office. They came back. So their name was actually not attached to this trace, but of course, people were identified and stigmatized. Also, Israel, Norway, they actually use GPS location data to find where people are, with the idea that if you find location and you know where everybody is, you can find out who is close to whom, and so you can identify contacts. Now, there is 2 problems with this. First, it doesn't work inside because GPS signals tend to be quite unreliable inside the building. But the second problem is that there is no such thing as anonymous location data. And so already in 2013, a very nice paper was published by some Belgian researchers from my sister university here, Villeneuve, that showed that if you have the location of a person at 4 moments in time during the day, this person is with high probability identifiable. So location data is very hard to make anonymous unless you aggregate it with very number of people, but individual location data is always non-anonymous. And so maybe if you go back to February, March, when the pandemic started, there was all the techies and all the app developers. They said, we actually have solutions to this. So we're going to use apps and we're going to use technology. We're going to solve the problem. And the privacy activists, including Carmela and myself and other people, we said, be very careful, because this can be a way to introduce technology which is highly invasive and which will be abused. And more or less, I think we got proven right. In Australia, the spy agencies were caught collecting some of this app data. The same thing in Singapore, the police did this, also in the UK. I know that Brazil has a strong privacy regime. Europe has as well. We have our GDPR law. And so in Norway, the privacy authority shut down the app. So there was an existing app that used GPS data. The privacy authority looked at it and said, this is actually violating human rights. You have to shut down this app. And so more or less Norway went back to square one. I think it took them about 6 months to get the Danish app adopted in Norway and be back online. But so we wanted to avoid this, because we know that once you collect data, it will always be used for other functions. And we wanted to avoid that the pandemic would be used to introduce even more spying technology as an excuse, because of course during a pandemic people are much more likely to give up fundamental rights. And the question is, can we give them back? So what we set out to do with a team of about 30 researchers, as I said, led by Professor Troncoso, there were some communication experts there, so experts in signal processing, experts in cryptography and privacy. There were legal people, and there were some epidemiologists as well. So it was a very interdisciplinary team. None of us was paid to do this, it was all a free effort, but in a very short time, we developed a solution which was actually privacy by design, which meant that we didn't want any central database which would be able to construct who talked to whom. So we wanted to find out who was close to whom without having a database with locations of people or contacts of people, because we believe that if we create this, this will be abused and it will be kept for after the pandemic. So we wanted to have only the minimal data to detect proximity, so which is kind of a built-in protection against function creep, because if you have only minimal data, it's very hard to abuse it for other things. So we didn't want to show who was in contact with whom, where, and when. And in particular, if you're not infected, no information at all of you would ever be known in any central system. And then also a fourth feature we wanted was that if the pandemic is over, it should be very easy to pull the plug and the data should disappear, and there should be no data left with traces of what happened in the past, who was where, who talked to whom, and so on. That was the main requirements. In terms of privacy, there were, of course, also functional requirements. There were many debates about, is this accurate enough? So, of course, if you walk by somebody at 3-meter distance, especially before the Delta variant, it's obvious you're not going to be infected. And of course, the other question is, do you have also false negatives where you're actually close to somebody, you have an infection risk, but it's not detected? I think this was a very big point of debate. We'll come back to it. I think the message is, after I think a year and a bit of experience, is it's accurate enough. Of course, it's not perfect, but in this case, I think the perfect is the enemy of the good. And it's also not the case that manual contact tracing is so perfect, right? People don't remember exactly how many centimeters they were close in which room, and was this person wearing a mask, and so on. So I think the app can also be imperfect and still effective. We wanted to avoid that people can falsely report infections. Think of a school scenario. I guess maybe this scenario is not so realistic because now kids want to go back to school, especially if they've been kept at home for a while. But if you go back to the beginning of pandemic, or maybe you look at the office, so some people may actually create false infections or infection reports, so that actually everybody has to be quarantined. So this is actually a risk. You want to have only people with a positive test be able to warn others of high risks. We want scalability to scale of about 100 million users, and we managed to get there, although in a distributed way. Everything should be open. So our goal was to have the specs and the software open, and I think there we succeeded for, I would say, 95%. Of course, we didn't want this to be mandatory because it's too easy to boycott by having two phones, by switching off your phone, and so on. And also, we didn't want any devices because many companies propose devices, but then you first have to design them, then you have to produce them, then you distribute them. And so that would create at least a delay of 4 to 6 months, and we wanted something that would be rolled out in 2 to 3 months. So what was the solution we proposed? It's a very simple solution with very simple cryptography. So everybody installs the app, downloads the app. The app has no personal data. This is very important. It doesn't ask for your name, your email address, or your phone number. So it actually is just an app without identification data. And the app makes a key every day. And this key generates codes. We'll come back in more detail how this works. And then in operation, when the app is operating, it actually broadcasts these codes over Bluetooth. So it just sends, it's called beacons. There is no connection being made between phones. It just sends random codes. And every time the MAC address of your phone changes, which is about every 10 to 15 minutes for privacy reasons, every time you also generate new codes or send new codes. So this is more or less what happens. At the same time, the app also stores codes it can hear together with the signal strength. Okay, so it actually receives how strong the signal was, it detects this, and it writes this down together with these random codes. So these codes don't have your name, and they don't give any indication, and at this stage, there is also no information in any central database. Every app has their own keys, and every day there is a new key being made. Now, if somebody tests positive, what will happen is that somehow they will get the test result. In the Belgian case, you get the result in the app, but in some other countries, you just get it over the phone from your doctor or by fax or whatever means of communication people use. And then you can decide to upload your key of the infectious days in a central database. So this upload is authorized, but it remains anonymous. You just upload a key. This key doesn't have your name. Of course, in some way, it's connected to you because you broadcasted the codes coming from this key. But if you look at this key, you don't know from where it is. And it doesn't have your identity data. It just indicates the key and the date on which it was used to generate codes. It's also a very short string. It's only 128 bits. And the average people are infectious for 3 to 4 days. So we send about 4 times 128 bits. And then the next step is that in this case in Belgium, it's every 6 hours. This is what most countries use. What the app does, it downloads all the keys from the database. So at this moment in Belgium, there is a few thousand keys in there. European scale, at the peak moment, there were 100,000 of keys in there. You download all these keys. And with these keys, you can actually generate the codes that were generated from it. And then you can compare this to the codes stored in the phone. And based on this, you can actually know whether you were close to a phone broadcasting these particular codes. And you can even estimate the distance. And then your phone will actually show a high-risk contact or a low-risk contact, or will actually show no risk. So there is actually, the computation of risk is done on the phone locally. Based on this key from infected people, we call the tag keys, transmission exposure keys, which generates the codes, and then you do a matching against the codes you have stored. In fact, it's a very simple and elegant system that allows you to indeed identify high-risk contacts. In practice, there is many more details. How do you authorize key uploads without identifying the person? You also have to hide IP addresses. There is also some dummy uploads we did. So in the fact that, of course, you don't want to identify who's positive by seeing who talks to the server. So every phone talks to the server and uploads dummy keys without authorization and so on. So there is many details in the system that in the end makes it quite complex. But the principles, I think, are very easy, and you can even explain this as an expert to non-experts like doctors or medical personnel. For those of you who want to see some cryptographic details, I will show a few. So this key is 128 bits. You have 2 key derivation functions. And with one, you identify on the left the rolling proximity identifier key. And then you encrypt a counter, which is more or less time elapsed in seconds or periods, multiple of seconds. You encrypt this to get a random code with AES. And then this code is then used with a different key, the second key on the right, in counter mode. And then you actually encrypt the metadata. The metadata is the model of the phone that was used, because it turns out that every phone has a different antenna. And to accurately estimate distances, you have to know from which phone, which model of phone this signal comes, and also the signal strength used as a sender. So this is different again based on phone. And so there is some data that is in principle doesn't allow you to identify the phone, because there is many people with an iPhone 9 or a Samsung S7. There is many of those, but this allows you to make a more accurate calculation. Of course, it was a lot of effort to do all the calibration, but this is more or less what's happening. So this is what's in this message that are being broadcast. And so on the phone, of course, what you see is either low risk, which means that you have no exposures, or a high risk, and then you get instructions depending on the cycle in the pandemic. If there is enough tests, you can get instructions to get tested. If there is not enough tests, which happened in Belgium, for example, in November last year, there were too many cases, not enough tests available, then you were told to quarantine. And if you had symptoms, of course, you were told to call a doctor and get tested. In Belgium, we also have another feature, which not every country did, was an intermediate risk. So you could also know if you didn't have a high risk, but you were close. For example, a year ago, I was teaching in a live class, and most of my students had the app. So at that time, a year ago, we had a penetration among students of about 80% to 90%. And so every time I had lectured, after a few days, I would actually get a medium risk, because apparently some of my students tested positive. Why was the risk medium? Because, of course, the distance between the lecturer and the student is typically something like 7-8 meters. So this doesn't give rise to a high-risk contact. So it's kind of amazing, but we managed to be quite successful with this. I'll come back to this, but we actually, very early on, we collaborated with Google and Apple, and we got them on the boat, and they made some of their own design decisions, which we didn't agree, but in general, it was a nice collaboration between several teams. And I'll come back to the involvement of Google and Apple. But so we actually managed to convince quite some countries in Europe, 32 countries use the app. What you see here on this graph is that the darker the color is, the darkest color is Ireland and Finland. There they got close to 50% penetration on the smartphones. Most countries ended up in 30 or 20%. And then in Eastern Europe, where there seemed to be less trust in the government, it was only like 10 to 15%. By the way, what we show here is only downloads, because in principle, we don't know whether you have the app and then switch off Bluetooth, or you don't use the app, or you just remove it again. Because of privacy reasons, we don't know who has the app, and we don't know who uses the app. So this is why we only estimate downloads. There is some tricks based on dummy messages, dummy uploads. We can actually estimate also effective use. So the last numbers in Belgium is we have on a population of 11 million people, we have 3 million downloads, a bit more, and about 1.2 million active users. So the number of active users has gone down. In the beginning, it was close to 80-90%, and now we're about 33%. But then again, I should tell you that the pandemic has also wound down. In Belgium, we have almost no measures anymore. The last thing we have, at least in Flanders, is the use of mouth mask on public transport. That's the only major measure we have. We also see two countries here in green, that's France and Hungary. They decided to deploy a more centralized system, where the risk calculation is done centrally. And this has a big disadvantage. It means we have a national system with more privacy risks. I'll come back to that. But also you can't couple this, because the database there contains highly sensitive data on location and contact of citizens. And there is no way that the French are going to give this data to the Germans or the Belgians. So this is a national system. We wanted an open international system. And so in the spring of 2020, we could convince the Commission to make kind of a gateway server, and this server went live about a year ago. It's called the European Federated Gateway Service. So all the green countries, plus since then, I couldn't find a more up-to-date graph. This is from around the summer. Estonia, Lithuania, I think, are now also connected. 19 countries are connected. So we each have our own app. Each country has a different way to indicate you have a positive test. Has a different interface with the health system, but at least if a German person comes to Belgium, the Belgians will be warned, and vice versa. If a Belgian person with the Belgian app goes to Germany, if he gets positive tested, he will later on, the Germans will be warned. So in fact, all these keys are exchanged at European level in a way that protects anonymity. So of course, you can know how many infected people there are in country X, although there also we add dummy keys. So there is no real identification information, but it helps you to assess risks at a very large scale, European scale. So at this moment, there is about 82 million downloads in those countries. That's an estimate. And active systems, it's something like 30 to 40 million, which is, again, 10% of the EU, which is not very high at the big picture, but of course it's a very high number of people, given it was an application rolled out in more or less something like 6 months and designed by a very small team of people. So for Brazil, it may be interesting that Portugal is still trying to connect to the European server. I don't know why they're struggling. They have an app that works quite well since a long time, but I think they're the only country so far that hasn't managed to connect to the European servers. They have also very high vaccination rates, so maybe the drive to do it may also be much less. So as I mentioned, very early on, already in the first few weeks, we realized that we had to talk to Google and Apple, because of course we wanted the version to work well on both Android and iOS. And we wanted this app to send Bluetooth beacons the whole time, even when your phone is in your pocket. And this tends to be a problem. It's a problem in Android because many versions of Android, many phones of Android, so the OEM added features, have a very aggressive power management, and they will switch off apps that try to send stuff in the background. It's even worse on iOS. On iOS, you cannot send any Bluetooth beacons in the background. So iOS, if the phone is in your pocket, if the screen is not active, then there will be no Bluetooth broadcast, which means that more or less the only way it works on an iPhone is you have the screen on all the time and the iPhone is in your hand, or you switch off all the sleep modes, which will reduce the battery life. So the only way that we can solve this is getting collaboration of Apple and Google. So Apple and Google like the protocol. They have introduced their own variants, and there was kind of some friction between academics and the companies about the details. So for example, we wanted not 1 key per day, but 1 key per hour, but they wanted 1 key per day for some reasons. There were some other discussions about protocol, but in the end, we're pretty happy. And so Google and Apple provided an API that implements the Bluetooth part, and that actually also protects this part. So it means that other apps can't get to it. So this is a bonus. And there is also a price paid, is that Google has only partially opened their code and Apple refuses to open their code behind this API. But this API, of course, is very solidly designed. It seems to work very well. And of course, then they also helped in deployment. One problem was that, as you saw, that in Europe there was a very quick deployment. In the US there was not. So Apple and Google actually then decided to make their own apps to make it even easier for the US states to roll out their own app. So there's now an Apple app since 1 year that does all this functionality as well. So a bit more history without going too much into detail. So we actually put our team together in March. In the US, there were very similar protocols being conceived called the Pact East Coast and the Pact West Coast. They had the same name, Pact. We called our protocol DP3T. So we didn't have time to convince or to find good names. I apologize for that. So we talked to Google and Apple, and they published their Google Apple exposure notification interface in April. In May, they rolled out their code, and then the code was finished of the apps. And so the first countries who launched were Switzerland and Germany. And at that moment, the ability started the discussion. And so the server launched 1 year ago, this European server. I also look at the website maintained by Google and Apple, which you find the URL at the bottom, which indicates that also in Asia, Oceania, there are some apps of this type that use this interface. And so I see even Brazil is listed, but I'm not sure how successful it is. I couldn't find much more information on the app in Brazil. In the US, the app is used in about 20-something states and territories, US and Canada as well. So overall, it's not a global major success. We didn't get 70% adoption or 60% adoption all over the world, but there is some countries and especially some groups in society where the app was pretty successful. So to come back on the French solution and the Hungarian solution, also Singapore solution, it's very similar in the sense that you have phones producing codes, and these codes are being broadcast and picked up. What is different is that if you test positive, then you upload all your received codes. So you don't upload your key, but you upload the received codes in a central server. And the central server has some, you can say, some backdoor keys, identification keys. You can find out who belongs to those codes, who sent out those codes. And actually, it can warn those, it can do a risk calculation as well, because it can know the power consumption, the power level. It can then warn those individual people. So they have an advantage that they know who's being warned, because of course, as you can imagine, if you deploy such an app, in Parliament, you get every week the question, and how many people were warned? And the answer is we don't know in our case. In France, they know because the central service warns people. It's a centralized system. And of course, the central service can also find out who had too many contacts, because at some moment in the pandemic, you're not allowed to see more people. But of course, if the central server finds your codes in too many places, then it knows you had too many contacts and you violated the rules. So this app is actually very useful for spy agencies who want to find out a social graph of who's talking to whom. And so this is why we really didn't like this application. And it's only being used in some Asian countries, and in Europe only in France and Hungary. There was a big conflict about this, so Google and Apple, as a consequence, denied the access to their interface, which more or less means that in the French app, you can't send anything in background in iOS. So it's a very strange observation. So this time, Google and Apple are on the side of privacy, although I think in general, it's governments who try to control privacy violations by Google and Apple. In this case, it's Google and Apple trying to violate or control privacy violations or potential violations of governments. So of course, it's a limitation on the success of the French app, because the French app, in fact, doesn't work very well on iPhones, because it doesn't send Bluetooth in background. So if you look at evaluation, unfortunately, the politicians and many researchers have read the study from Oxford, which appeared very quickly when apps were a very hot topic in the third month of the pandemic. And this study said that you need 60% adoption to be effective. The researchers actually objected against this interpretation of their research. It is not what we wrote, but this is what politicians remembered. Now, there was follow-up research, which actually didn't make the world press as much, which actually shows that adoption of 20 to 30% actually works, in particular if it's in small groups. So, for example, look at the university. I'm teaching some students. These students intermix with each other. If you can get inside the university 60, 70, 80% adoption, in fact, this contact tracing app will work extremely well inside the university and will warn people effectively. There is also an interesting modeling study published that showed that if you combine manual tracing with app tracing, you actually will do substantially better. So the Oxford University assumed there was no manual tracing, which is not really a good thing. Something is also was overlooked in this study is that actually, if you use an app, you can warn people within 6 hours, which you can hardly ever do. It's infeasible manually. You can't call people fast enough, especially if there is many cases. So you actually warn people earlier, and they will go in quarantine earlier. So they will actually infect fewer people. So there was a lot of debate, and I don't want to repeat that debate on accuracy. So indeed, if you look at distance estimates, so here you see what happens if you measure single energy as a function of distance. And so you see it's not a graph like the blue curve, it's an exact curve. It's very fuzzy. It depends on the way you hold your phone. Is your phone in a handbag? Is your body in between? And so on. So it's very fuzzy. There is quite some studies being done. I think this is a very nice study done by the Swiss researchers. They more or less showed, and I don't have time to explain it in full detail, but you'll get the slides and you can look at it. So they more or less showed that if you look at signal levels of 55 to 62 dB, and that's where we're looking at, then you actually get a very high recall. Between 60 and 80% of the cases are being found. For depending distance here in blue is 1.5 meters, and the distance in green is 3 meters. So more or less, if you look at this range, 50 to 62.5 dB signals, you detect 60 to 80% of all the people within 1.5 to 3 meters. And you actually have a very high precision. So you have a precision that actually comes very close to 80 or 90% as well. So in general, I think these apps are not extremely accurate. People expect that this is 99% correct. It's more something like 70 to 80%, but actually that's good enough. Because what most people don't understand is that the attack rate of the virus, and this was before the Delta variant, is 1 in 7, which means that if somebody has a high-risk contact, only 1 in 7 of the people will actually be infected. So, which means that if somebody lists you 7 contacts, unless the person is a super spreader, or unless maybe with the Delta variant now it's higher, but at least in the first phase of pandemic, only 1 in 7 will be really positive of those high-risk contacts. So in some sense, contact tracing and quarantining is a very noisy business. You already make 6 out of 7 decisions wrong. And whether the app is now accurate with 80% or 90% or 75%, it doesn't really matter, right? You want to just find enough people. You don't want to multiply this by a factor, but all this discussion which we saw and claimed this app cannot work because it's accurate enough, I think was a fake debate, because it's actually as good, if not better, than manual tracing. And it's good enough because it's not an exact science anyway to determine who's infected. A very interesting study appeared on the UK, because the UK also uses this interface. The UK, because of Brexit, is not coupled to the European servers, so they have their own system. And their app is interesting in the sense that it collects more data than the other apps. So, for example, it counts verification warnings, it counts people who get warned, and it collects a little bit of more personal information, which we wanted to avoid in continental Europe. But it allowed them to do a very nice study. So they had, in the last fall, in this period of 3 months, they had 21 million downloads, 1.5 million notifications, and they could actually show, based on different statistical methods, it's in a very nice paper published in Nature, that actually between 200,000 and 900,000 infections were avoided, and several thousand deaths were avoided thanks to the app. It's very difficult to extrapolate this, what happened to this on a global scale with the app, because there is different adoption rates and so on. But I still think that if you look at the big picture, it's clear that we have, with this simple app developed by the academics, of course with support of Google and Apple, we probably have saved or stopped millions of infections, and probably saved maybe 5,000, maybe 10,000, maybe 20,000 lives. So I think even in Belgium, I only saved 5 or 10 lives. I still feel that I've been very productive in the last 1.5 year. We also wrote a paper explaining you why it's so difficult to evaluate such apps, because there is a lot of health system factors in there. So is success? Well, I think we're very happy that we showed that in a very short time, you can roll out a privacy-friendly system that still is quite effective. It's not perfect, but it's actually quite effective. We've been criticized a lot by some people who said, well, your app leaks some information. Well, of course, contact tracing leaks information. And also here, if you go on campus and you put Bluetooth antennas everywhere, you can actually find out a lot of things about infected people. But then if you go on a campus and you put cameras everywhere, you can also find a lot about many people. So the question is this really this risk worth the benefits? And my answer would be yes, but of course some other people tend to disagree. So again, where it is effective is it's faster, so people get quarantined faster. It reaches people you don't know, like on public transport. And what we've seen in Belgium in the peaks is that the manual contact tracing system was overwhelmed very quickly. So as soon as the number of cases goes up, at some stage they can't follow anymore, and then they come too late, which means that the manual contact tracing becomes useless. And so the app, based on technology it uses, it can be overwhelmed. It can deal also with a very high number of infections. So there is many ideas to propose to improve it. And for example, you can get better privacy by using a variant of Bloom filters called Google filters. Very nice, but it required a bit too much communication overhead. In 10 years, we'll all have ultra-wideband in our phones, and ultra-wideband is much more accurate in locating people than Bluetooth, low energy, so it would work better. If you want to prevent replay attacks, where you take codes received and you admit them somewhere else, you should make a connection between two phones using Diffie-Hellman and then send things encrypted. The problem is that if you enter a bus and there is 12 people using the app, with the current Bluetooth, you can't make 12 connections fast enough. It just doesn't work. Relay prevention, which means I take a signal and I broadcast it somewhere else. You can only stop this if you add location information, which has privacy implications. And there was also a very nice ID published, unfortunately 6 months too late, by Christoph Pirtzak on ePrint server, saying that you could use some commitments and MACs for delayed authentication to actually make slight improvements to the protocol and to avoid some of the attacks involving replaying or relaying signals. The problem is also that some of these improvements, of the last 3 improvements, actually also create digital evidence. So they actually make it possible to find out who was where and who was infected. So sometimes you actually want a less secure solution that leaves less traces than a more secure solution. I will skip the details here because that's too boring, but you can look at the DP3T paper. So everything of DP3T, the software, the design documents, the security analysis is open source on GitHub. And so in general, we made a very interesting study of comparing all the systems, the centralized system in France, the decentralized system, systems based on Bluetooth, system based on other approaches. And I don't want to go into details. I think what is interesting, the lesson we learned is that analyzing security of such complex systems where location plays a role and wireless signaling and cryptography is actually very tricky. And so we now have tools. If you have a cryptographic protocol, there's lots of tools where you can have your protocol analyzed for properties. If you have a problem like this that involves location, transmission, and maybe things like signal energy, and then cryptography, well, I think the analysis and comparison is very, very tricky. And I think the team there did an excellent work in showing how you can evaluate such complex things and compare such complex protocols and then make a cost-benefit analysis. I think that's a very interesting lesson learned, that there is lots of research to be done here, how we can do this better in the future. The final few minutes I want to spend on presence detection. But this is something that was introduced in some countries, also proposed. It didn't get such a big rollout, but I know that France, Germany, and the UK added this. So the idea is that you want to find out whether somebody has been in a certain restaurant because you suspect that somebody who was a super spreader was in the restaurant, or there were several infected people in a restaurant or a theater. Most epidemiologists would like to know this because they want to know where infections happen. And so in particular, since we knew, I think it took a while, but we realized that spread happens mostly to aerosols, so to the air. I think then people were more interested in identifying hotspots and finding out who had been in a certain place. What they did in most places, I guess this was in Belgium and in most of Europe after the first wave, is in restaurants, they wrote down your name, or in cafes, your name and your phone number. Then, of course, people said they were Donald Duck or Bill Gates, so people actually cheat then, so this is not very good. And of course, this data was also being abused, so of course, people in the bars then used this to afterwards harass girls that had been in the bar because now they had their phone number and so on. So it's hard to enforce, and then it's impossible more or less for the health workers to go around all the restaurants and bars and look who has been there to find out whether maybe there was a hotspot there for infection, or maybe a patient at risk was there. This is just not workable, especially at high levels of infection. So a subset of the team of DP3T actually got together and developed another system called Crowd Notifier, and they trialed this in Switzerland. The requirements were that you don't store visits of venues on the phone, you don't store who visited in a central server, or you don't store it in a server or in any computer in the bar or the restaurant. It should be easy to use. Don't use high battery or bandwidth, and it should work on every smartphone. There should be no database of venues, because it was a concern that this could be used to discriminate against certain venues, or also I think people wanted to avoid that this was used to identify specific venues correctly or incorrectly as being high risk. And also we want to avoid that it should be possible to profile people based on the venues where they go to. And obviously you can imagine how people could be profiled based on certain preferences, sexual preferences, political preferences, religious preferences, based on the place where they go to. And the French system requires extra hardware. We didn't want that, and it should also work if there is larger restaurant with multiple rooms. And then a very interesting feature of this design is that the health authority is in the loop. So the health authority decides when a place becomes a high-risk place, and not the software, or not the smartphone, or not the user, but the health authority. And this is something which I think we learned from the first experience, that if you try to design a system and you don't give a central role to the health authority, in many countries, the health authority will boycott the system and it will not work. And of course, we want it to be secure. So what you have today in the three big European countries, France, Germany, and the UK, is a very simple system. You put a QR code up in your bar or restaurant. If you visit the bar or restaurant, you're expected to use your app to scan the QR code. And then the time, you have to write down the time in your app. So your app stores QR codes, places where you've been, plus the time you were there. And everybody does this. And if you're infected, you actually upload QR codes and times to the server. And then the app, at a regular basis, downloads these QR codes and times and checks whether there is some intersection within an infected QR code and time and your time, and shows you a high risk. So this is reasonably privacy friendly. It's comparable to the other system. But of course, there is profiling of hot venues. You leak some timing information. If somebody can hack your phone, it actually contains QR codes, so they know when and where you were somewhere. And so there is actually still quite some information that is being revealed. So cryptographers designed a very cool system to get the same features in privacy, and amazingly, they used for this identity-based encryption. So identity-based encryption is something which was proposed by Shamir in the 80s, was realized in the late 90s by some Japanese researchers and Bonnet and Franklin. But we didn't see big uses to it because it's also seen as a big key escrow system. So it's not really a good system for standard encryption, although it has cool properties. So your name is your public key, or your attribute in your name is a public key. And so the idea is that you generate a key pair in the bar. So the bar has a simple piece of software on the web where it generates a public key, which is the QR code you make public, and a private key, which is the QR code you print and you store somewhere in a safe drawer. And then for the user, the experience is the same. So you scan QR codes, but what you actually do is you encrypt the QR code on your phone together with the time, at least some rough time indication, the day, but not more, with identity-based encryption. So if you hack into a phone, you only find encrypted QR codes, so you don't know where this person has been, or you can't make a mapping of which code is where, because the only thing on the phone is encrypted information. Now, what happens if somebody gets infected, or if several people get infected? At some moment, the health authority can decide that there is a cluster and that maybe in this restaurant or bar there is a risk. Then they will say to this restaurant or bar, can you please give us some information, because we think on last week on Saturday or last week on Sunday, there was some high-risk event in your bar. It was a hotspot. And then with some clever cryptography, this bar will scan this QR code and compute a derived key from it, which is actually a key to decrypt QR codes on a specific time slot. So you actually don't give the key to decrypt all QR codes, but only QR codes for this bar for specific time slot. And so this key you upload in the central database, and then the story continues. All the phones download these keys, and then they try to use this key to decrypt for this time slot the QR code. If they find a meaningful code, then they can warn people of a high-risk content. So you kind of did some identity-based magic. On the phone, there is only encrypted information, but you can still find out when somebody was at a particular place, when this place has been marked as high risk by the health authority. But this system, in the end, didn't become very successful for several reasons, because it was tried in Switzerland. But I think by the time it was ready, many countries decided that this was no longer what they wanted. And also some countries in Europe actually had already implemented the previous system. Here is a description in text. So we also made a detailed analysis of the crowd notifier team, comparing all the security and privacy features of all these systems. Again, a lesson learned, a great research problem, how to do this. Because it's very different from normal protocol analysis, because you have to take into account many other features. And so the analysis is quite difficult and subtle. Okay, so time to wrap up. So I still think is what was achieved so far, even if it was not perfect, it was a little miracle, because more or less at the beginning of the pandemic, 30 researchers got together. We decided to work very hard. Luckily, we could align also with Google and Apple, who then also took a bit of control, but at least they took many of the ideas and realized them. And so more or less, we managed in a very short time to make an application that's potentially useful, and I think that actually proved its use, but used by 100 million users and more. With no cryptography, I think if you look at the countries where it failed and succeeded, I think it's too early to do the complete analysis. And I think we will do this probably in the next year. But it was very important to get public health authorities and professionals involved. So in Belgium, for example, we got the central health authorities. They were quite helpful and supportive. The individual doctors were very negative. And they told people, oh, don't use the app. It's too complex. It doesn't work. Oh, I mean, I don't want to work with this app. So we somehow could not convince the doctors. I also been talking much more to lawyers in the last 1.5 years than I ever did before, although I'm myself expert in the Belgian privacy authority. But so there was a lot of debate. And very interestingly, the lawyers hate the fact that we don't know how many people get warned, because they say you can't deploy a system unless it's proportional. And so it can only be proportional if you can prove it's effective. But this system is designed in such a way that you actually don't know very well whether it's effective, because you don't know how many people get warned. So should you really be able to allow to use this, because your system is too privacy friendly? So in fact, we prefer a system that's less privacy friendly, where you can prove it's effective. So this is an interesting debate. What is more important? You know for sure it works, or you know for sure it's private. A mistake made in many countries was to write all the details of the technology in the law, which I think you should never do. And of course, we also learned the devil is in the details. There were bugs discovered, as in any system. Also, Google had major bugs. But I guess this is a fact of life. You can't deal with this. I think then the final lesson learned I want to share with you is a very interesting lesson, which I think everybody who wants to roll out technology should remember, which is if you add digital on top of a thing that's broken, you will have a broken digital thing. So some countries, their health infrastructure was very distributed, was still based on facts, was still based on individuals doing stuff. If this is your core health infrastructure architecture, if you come with a fancy app, this app is not going to solve it. So you have to redesign or change the interface in every country, which was a very big effort, which many national researchers did, and based on the overall architecture, to more or less match the app to the health infrastructure. Because if you cannot make one app by Google or Apple and believe it should work in the whole world. I think that's a very important lesson learned. I'm going to stop here. Thank you very much for your attention.
Very nice. Thank you, Bart. Very, very nice talk. Very interesting. I guess you could give it's a very nice motivation for a crypto course. I mean, there are so many issues there, so many interesting things coming up. I have two questions I'd like to ask you. Until people can get their questions through here, maybe we'll have a few more. I'm not sure. You mentioned Brazil as you got the information somewhere that people downloaded. Is that all you know about it? That people downloaded it, or what? I mean, is there anywhere I can dig in to find out where it's being used? Or
so, if you want to use this Google Apple exposure notification interface, right? You need to get permission from Google and Apple, because you have to get a special key to activate this interface. Why is this? Because otherwise people could write some code that collects all these Bluetooth things using this interface and then start spying on other people using their phone. And also Google and Apple make sure that if you use this interface, you don't create a central database like the French or the Hungarians do. So the French app and the Hungarian app don't get access to this interface. So Google and Apple made some rules. It's quite bureaucratic, but more or less you have to get their authorization to use this interface, which means you have to have your national health authority or your regional health authority. So for example, in Belgium, we had one, but in some countries it's by region. You have to have them write a letter to Google and Apple saying, this is the app with this name that actually will use your interface. You have to submit the source code. They look at it to make sure it's privacy friendly enough and doesn't violate the rules, and then they give authorization. Now, the website I showed on my slides, and I'll send my slides, is actually a website maintained by Google and Apple, and they indicate in which countries they have given authorization to an app to use this. So somebody in the Brazilian government, because Brazil is listed there, must have gotten permission for some piece of code or some app to use this interface. It doesn't mean, of course, this app has been rolled out at large scale or is connected to the health infrastructure. That's another question. But at least there is at least one app in Brazil authorized by Google and Apple.
Yeah, I think I have seen it. I mean, I have seen this. I mean, its interface, but I wasn't sure what it had behind it. It looked like what you've mentioned, but I would like to know that a little better. Another question I would like to ask you: were there any? I mean, you talk about how adoption works and all these little conditions, and was there any social incentives by the government to adopt for a citizen to adopt the app, or to make an effort to adopt the app, or something like that? I mean, I find that the adoption is really a big problem.
I think definitely what we wanted to avoid is that you could only go to a movie theater or a bar if you had the app, right? So we wanted to avoid that, although of course some companies said to their employees after the first wave, you can come back if you have the app. And then immediately the law said in Belgium, I think other countries, well, this is not allowed, right? Because it discriminates against people without smartphones. And in general, we don't want people to force to use it because, of course, you can also switch off your Bluetooth all the time, and then you go to your company, you show the app, and then the app is useless anyway. So I think it's based on trust. But there was one city in Belgium that were immediately stopped. They said, the first 500 people who get show that they have the app installed, they get from us some goodies from the city, and immediately the minister called them and said, stop this, right? I think of course, there were media campaigns. In Belgium, the budget was very low, and the campaigns, we had a campaign by the Football Association that I think was the most effective one because they keep showing it in football games, side to the field, use the app. But if you, for example, in Germany, on every shop, every government building, there is wash your hands, you wear a mask, but also use the app. And that seems to have worked a lot. I think what also worked if ministers went on TV and showed they were all using the app, which in Belgium I never managed to do. They refused to do that. It's still a mystery why. But in Belgium we had almost no budget, and the ministers refused to show the app on TV, although they were on TV every day, right? And it doesn't cost them anything. But so I think they were scared that something would go wrong and then they would be associated with it, I guess.
Okay.
But my main lesson is, if you look at the European numbers, it is aligned with the trust of government and also with incidents. In Austria, the first app rolled out was terrible, and then some human rights group or activist group showed that this was a terrible app. And then they fixed the app, but it was too late. People said, oh, this contact tracing app, that sucks. And they could never get back to any decent numbers because they broke the trust in the beginning.
What about was the app ever tested in a more or the adoption? I meant not the app itself, but the adoption aspect of it tested on a closed environment, say in a university or a place where you had some control over, or you could put some incentives, or you could put some. You can't come to work if you're not using the app, for example, right? It's not so bad as a requirement, say.
Some companies tried it, but as I said, in Belgium it was illegal, so I don't know. So I don't think we have this. The UK study is very interesting because they report when you have a test. They actually detect where you are, in which county you are. So they have data per county, and they have adoption data per county. So they have a bit more data. Also, the Irish have a bit more data, which of course allows you to do conclusions because you can then look at the adoption data and you can look at the pandemic progress. And this is how they were able to produce their numbers. Right? But I think, for example, in our university, especially last fall, it was very effective because people were using it and people were interacting with it and say, oh, I had a high-risk contact, I should stay at home. And so what I'm doing together with two people in human computer interfacing, we've done a study. So they interviewed 30 or 40 people, mostly students, and we're still analyzing the results. Where we asked them how did they use the app? Did they trust the app? Did they follow up on the advice of the app? What they liked, what they did? So it's a more in detail study. And there is a few more in other countries, but I think the one we do is actually one of the more ones in depth. Actually interview people for an hour to ask about how they use the app and so on. And so we hope to publish the lessons learned from that in the next months.
Do you think gamifying it would be something interesting, or ever people looked at it?
That's something many people proposed to us, but of course the problem is if you want to keep it anonymous, it's very hard, right? There is ways. I think there is now ideas to do this. You can do things with homomorphic encryption. Actually, you can encrypt some information on the app and add it to a server. But you should also look at the time scale, right? We designed this protocol in March, April. The Google made their interface was rolled. We didn't have time to do invent some new crypto thing. And then I think afterwards, the problem was that I think in most countries the budget was limited. And then in some other countries, some large companies, they consume enormous amounts of budgets to just maintain it. But there was no appetite. Like what you should do, I think it's a lesson learned that I agree. You should actually change as an app all the time. We added vaccination information. We added vaccination where you could be vaccinated and so on. We now add advice per week to the user. But in fact, you should indeed, ideally, what users expect is that this app changes every month and has more and more functions. Now,
Okay.
Many countries got to give their app a second life by adding vaccination certificates to the app. But I was against it for Belgium because, of course, then you break the anonymity because this thing has your name. So that was a trade-off. So, of course, France, Germany, they added vaccination information to the app. And then, of course, that gives immediately a boost of millions of downloads. But in Belgium, we decided to have a separate app for privacy reasons. And I think Google also is looking at kicking those apps out of the App Store because they actually don't like it. It's against the contract or the rules that you also provide vaccination information in the app with your name and a certificate from the government. But it's probably for society would have been better to do it because probably would be more users of the app. But so you always make difficult choices. And yeah, you can't know. I mean, if you add the information, people say you're Big Brother. If you don't add it, people say your app is boring. It doesn't give enough information. Yeah, I guess you can't please everybody, and it's hard to make the right choices.
And the unavoidable question: what would you have done differently?
Well, in Belgium, we also wasted 3 months arguing with many things. I think we probably should have even talked more to healthcare providers and healthcare systems and looked at this. So we made several protocols to interact, but that took a very long time. And I think something I wish I could have done differently, I think the design would not be very different. As I said, if they'd given me more budget, I would have kept changing the app, but that was not an option. We got €1.5 million in Belgium, which is 20% of the Dutch budget and 5% of the German budget. So we didn't have much money, but I think that I would do. I keep adding stuff, that's for sure. That's a very good thing. And the other thing is I would have really tried to get more politicians on board and more doctors on board. So that actually, if doctors tell people use this, then they may do it. But of course, doctors were overloaded and they're typically not technology freaks. And so we spoke to the Association of Doctors many times. And I probably sent an email to all the doctors, and doctors probably deleted the email or didn't read the email. Right? It's kind of how to engage doctors. I don't know. That's not my discipline. And I guess we failed there in some extent.
Well, thank you very much, Bart. Again, very nice talk. I don't want to say let's learn for the next pandemic, but that's in a way, that's what we're doing. Thank you very much. Thank you. And I hope I can meet you soon in person.
Yes,
okay.
I hope so.
Thank you.
Hope to come to Brazil soon. Okay. Thank you very much.
And I can come to Belgium. Bye.
Always very welcome. Goodbye.
Bye.